Assalamu alaikum, my dear students. I hope you are fine by the mercy of Almighty Allah. Today we will discuss about the fat-soluble vitamin. The remaining portion of fat-soluble vitamin is vitamin K and vitamin E. We will talk initially about vitamin K, then we will talk about vitamin E. First, the vitamin K. There are three types of vitamin K: vitamin K1, K2, and K3. K1 is derived from the plant source. It is named as phytoquinone. That is, the vitamin K is known also as phytoquinone. Vitamin K2 is menaquinone, synthesized by intestinal bacterial flora. This is very important that it comes from the intestine, endogenously synthesized. And lastly, the vitamin K3, there is the menadione. It is the synthetic derivative of vitamin K. So there are three types of vitamin K: vitamin K1, phytoquinone; vitamin K2, that is the menaquinone; vitamin K3, that is the menadione; and vitamin K1 is the phytoquinone, which is derived from the plant source. Vitamin K2 menaquione is derived or is synthesized in the intestine by the bacterial flora. That is, it is endogenously synthesized. And lastly, vitamin K3, there is the menadione, which is synthetically derivative of, there is a synthetic derivative of vitamin K. Now comes the source. As usual, there is dietary source or the exogenous source. In exogenous source, as you know, or dietary source, as you know, green leafy vegetables, cabbage, meat, liver, egg yolk, milk, and milk products. In respect to endogenous source, as I told you, there is the menaquinone. Menaquinone, that is synthesized by intestinal bacterial flora. So endogenous source is intestinal bacterial flora. So in case of source, there is two things. One is exogenous, that is the green leaf vegetables, cabbage, meat, liver, egg yolk, milk and milk products, and endogenous is the synthesis of intestinal bacterial flora. Now, daily requirements. It is the 70 to 140 microgram per day. In respect to metabolism, dietary vitamin K is absorbed with dietary fat. It's quite natural that it is absorbed as soluble in fat solvent, dietary fat, with the help of bile salts and micelle. That is, the dietary vitamin K is absorbed with dietary fat with the help of bile salts and micelle. From enterocyte, it is carried to blood via chylomicron. From enterocyte, it is carried to blood via chylomicron. Now comes about the function of vitamin K. The main function of vitamin K is the maturation of clotting factors. The clotting factors which is matured by vitamin K is factor 2, factor 7, factor 9, and factor 10. Actually, here vitamin K helps in post-translational modification, post-translational maturation of these beta factors, of these clotting factors. Here, vitamin K acts as coenzyme of carboxylase. The basic enzyme is the carboxylase, and vitamin K acts as coenzyme of carboxylase. It helps in carboxylation of certain glutamic acid residues of these clotting factors by carboxylase enzyme. And secondly, it has got a very important role therapeutically, particularly in respect to neonates, the premature babies are very much in need of vitamin K injection, because newborns has sterile intestine, and that is why intestine cannot synthesize vitamin K. After the birth of a baby, initially the baby is devoid of vitamin K, and as it is endogenously synthesized by the gut flora, the intestine is clean, intestine is sterile, so the gut flora, there is no flora, the intestine is sterile, so there is no bacteria, and so there is no synthesis of vitamin K during immediately after the birth of the baby. But as there is umbilical cord is there, if there is any, due to any cause, the cord is loosened, the tightening is loosened, if there is bleeding occurs, or there is bleeding occurs due to any reason, that bleeding will not be able to control. So vitamin K is to be given intramuscularly as a single dose, again. Other points is this, that hepatic reserve is low because of inadequate transplacental transfer of vitamin K from mother to the baby during intrauterine life. Inadequate transplacental transfer of vitamin K from mother during intrauterine life. Hepatic reserve is also low because there was inadequate transplacental transfer from the mother during the intrauterine life. Again, low vitamin K concentration in breast milk of mother. Mother breast milk is also containing very low vitamin K. So after the born of the baby is run short of vitamin K. So we are to give a single dose of vitamin K intradermally, intramuscularly injection, in case not intradermally, intramuscularly in a newborn baby. It is a routine practice nowadays to give a intramuscular vitamin K injection after the born of a baby. And the cause is three causes are there. One is intestine is sterile. Second cause is transplacental transfer of vitamin K is inadequate, and the hepatic store is very low, and mother breast contains very low quantity of vitamin K. These three are the reasons why we give a vitamin K injection in a single dose intramuscularly after the birth of a baby. Again, intramuscular injection in patients with obstructive jaundice prior to surgery we advocate, because in obstructive jaundice due to lack of bile salt in intestine, there is malabsorption of fat and vitamin K, leading to inadequate vitamin K dependent clotting factor synthesis. In obstructive jaundice, what happens? There is lack of bile salt in the intestine. So there will be malabsorption of fat and vitamin K, leading inadequate uh, vitamin K dependent clotting factors synthesis. Therefore, prior to surgery, vitamin K is given to ensure adequate synthesis of clotting factors that helps to avoid undue hemorrhage during the operation or during the surgical procedure in case of obstructive jaundice, because in obstructive jaundice there is lack of bile salt in intestine, there is malabsorption of fat and vitamin K, leading to inadequate vitamin K dependent clotting factor synthesis. Therefore, prior to surgery of obstructive jaundice patient, vitamin K is given to avoid undue hemorrhage during the operation. And thirdly, it is used as an antidote in dicumarol. There is the warfarin poisoning. In warfarin or dicumarol poisoning, it is used as antidote. These three are the therapeutic use, and initially we talked about the synthesis of the clotting factor. There is the major function of vitamin K. If you say in one sentence, the function of vitamin K is the post-translational maturation of clotting factors 2, 7, 9, and 10. This much you must remember, because it is a very important oral question in examination. Now come to deficiency disorder. In case of deficiency, there is the hemorrhagic phenomenon, impaired blood clotting. Naturally, there will be impaired blood clotting, and hemorrhagic diseases like tendency to bleed profusely from minor wounds and extensive subcutaneous hemorrhage from minor bruise, prolonged clotting time. Actually, a true deficiency is unusual because intestinal bacterial flora is sufficient to produce or synthesize the vitamin K. In geriatric patients where a patient gets antibiotic, in that case vitamin K supplement may be given, because there is formation of hypoproteinemia. So these are all about the deficiency disorder of vitamin K. Now we a little bit about the vitamin K toxicity, that it may cause overdose of vitamin K, hemolytic anemia, and jaundice. That is all about the vitamin K. You have to remember the types, you have to remember the sources, because it is intestinal bacterial flora, the endogenous synthesis, and functions, metabolism are important for you all the coming examinations. Now come vitamin E. The active form of vitamin is very much asked in the professional examination, particularly in oral examination. There is the tocopherol. The active form of vitamin E is tocopherol. You have to remember it, that the active form of vitamin E is tocopherol. Next is the source. As usual, plant source, there is the vegetable oil are rich sources like soy oil, corn oil, palm oil, etc. And animal source is fish and fish liver oil, egg yolk, milk, and milk products. Daily requirement is 15 milligram per day. In respect to metabolism, dietary vitamin E is absorbed from intestine along with fat with the help of bile salt and micelle, and then it is carried to blood through chylomicron as in case of vitamin K, because these are all fat soluble vitamins. From chylomicron, vitamin is taken up by liver and adipose tissue where it is stored. The function, in respect to function of vitamin E, you have to remember one thing, that is it acts as antioxidant. It is very important. Two things is very important in regarding of vitamin E. One is the name of the active form tocopherol, and another is in respect to function, that is it acts as an antioxidant. It may be asked in your exam that what are the vitamins acts as antioxidant. In that case, you have to mention vitamin E. It prevents lipid peroxidation and protects the biological membrane. And prophylactic function reduces the coronary artery disease, delays the onset of cataract with vitamin C and beta carotene. This is the long term benefit. If you use vitamin E with the vitamin C and beta carotene, then there may be the delay of the cataract formation. And also the vitamin E may reduce the coronary artery disease. In respect to deficiency symptom, hemolytic anemia of newborn and retinopathy. Toxicity, it is least toxic among the fat soluble vitamin. So these are all about the vitamin E and vitamin K. The two vitamins are more or less very important for the oral examination in the professional examination. So these are all about the vitamins. You have to read the soluble vitamins initially, then go for the fat soluble vitamin one by one, and you have to remember all the active forms of the vitamins. You have to remember the sources, you have to remember the functions, and deficiency disorder. These are the main points to read with the definition and classification of vitamin. Initially, we start the examination with the definition of vitamin, and subsequently we ask about the classification of vitamin, either vitamin B complex or water soluble vitamins or fat soluble vitamins, whatever it is. We start anyone with this, and naturally the next question is the active form, and the questions may regard about what are the antioxidant vitamins, what are the endogenously synthesized vitamins, and what are the functions or deficiency disorder of such all the vitamins. So you summarize all those things, and if there is even any question or anything to understand, you may consult with me in my free time. Thank you all. Be fine. Allah Hafiz.